Here is a 1600 word YouTube article based on the video you shared, https youtube.be косая черта дабзуковбу закрывающая круглая скобка, written in simple, engaging, and narrative style for maximum watch time and audience impact. I couldn't lie at a transcript of the video, but I found the video title and theme from official YouTube metadata. Офицер отвез свою дочь в больницу, заметив, у нее растущий живот. Врач осмотрел ее и вызвал 911, which translates to звездочка, a police officer took his daughter to the hospital after noticing her belly growing. The doctor examined her and called 911. YouTube. If expanded this into a compelling article you can use as description text, storyline on YouTube or your blog to attract views, engagement, and emotional connection. There are moments in life that shake us, that make us question everything we think we know about the world. This video tells one of those stories, a story of instinct, fear, hope, and unexpected miracles. What begins as a simple day turns into a life-changing moment for one father, his daughter, and the medical team who stepped in just in time. The narrative begins with a police officer, a parent first, and a guardian of the community second. Like many officers, he is trained to react to danger, to assess risk, and to make split-second decisions. But that day, his training took on a different form. It wasn't a loud crash or a crowd in chaos that alerted him. Instead, it was something deeply subtle, something only a parent could notice. As his daughter moved quietly beside him, he observed something unusual about her belly. It wasn't pain as he was expressing, nor was he crying. There was simply a visible change. A growing belly that didn't make sense for a child her age. YouTube. Any parent knows that moment when something doesn't quite look right with their child. A slight pallor, muffled sounds, a change in gait, these are the silent signals that push parents to act before doctors even consulted. For this officer, that moment came when he noticed his daughter's abdomen looked distended, swollen in a way that was not normal. His instincts kicked in, but officer instincts are different from parent instincts. Only a parent can sense when something is off with their child's health in a way no training can teach. YouTube. Without hesitation, he put his role as an officer aside and stepped into the role that mattered most in that moment, that of a father. He rushed his daughter to the nearest hospital, not knowing what awaited them but certain that something was wrong. Arriving at the emergency room, the doctor on duty took one quick look and immediately called for emergency services, dialing 911. There was no time to waste. The situation was serious. YouTube. The scene inside that hospital room is a mix of anxiety, professionalism, and urgency. The doctor palpated her belly gently, trying to detect the cause of the swelling. Was it internal bleeding? Could it be a tumor? Was it a rare infection? These questions raced through the minds of the medical professionals, but most importantly, through the heart of her father watching every moment pass. His calm patter of reassurance to his daughter hid the storm inside him, the fear, the uncertainty, and the desperate hope that everything would be okay. YouTube. In moments like this, time stretches. Every second feels longer. The doctor explained that her condition, while rare, could be life-threatening, if not treated immediately. It was a race against time, not just to identify the problem, but to save a child's life. Across the room, vital signs were monitored, blood tests were ordered, and ultrasound machines were wheeled in. The father, still in his uniform, passed the edge of the room, watching worriedly and praying silently. YouTube. In hospitals, doctors often speak a language of probability and statistics. They speak of symptoms, risk factors, and diagnostic certainty. But in this case, even medical professionals felt a sense of urgency that words alone couldn't describe. They worked with a precision honed by years of emergency experience, but they also worked with a deep sense of humanity, because it wasn't just a patient on the table, it was a little girl with freckled cheeks and hopeful eyes looking up at her dad. YouTube. For the father, watching his daughter in that sterile room was both the hardest and most revealing moment of his life. Years of serving and protecting others had prepared him for all sorts of threats, from riots to robberies. But nothing in his career prepared him for the fear of watching your own child's life hang in the balance. The uniform he wore was a symbol of safety for others, yet in that moment, he needed safety for his own family. YouTube. Finally, after what felt like an eternity, the medical team gathered around the chief physician. They had results. Some diagnoses can be delivered gently, with soft words and light tones. Others are delivered with a calm urgency, with the kind of compass that tells you the situation is serious but under control. The doctor told him that they had identified the root cause of the swelling, and that immediate action was required to treat it. YouTube. In the world of medicine, words like urgent and immediate are not used lightly. They mean procedures, interventions, and sometimes surgery. The hospital staff prepared the room. Nurses readied the instruments. Machines were it. And through it all, the little girl, brave beyond her years, squeezed her father's hand and whispered that she wasn't afraid. That moment, one filled with courage, innocence, and love, is unforgettable. YouTube. There is a force in life stronger than fear, and that force is love. Love pushes parents to act when others would hesitate. Love gives strength to children when their bodies feel weak. Love fills the spaces between hope and fear with quiet determination. This hospital room, filled with urgency and emotion, was also filled with an invisible armor forged by that love. YouTube. The surgery, or medical procedure, began. It was a critical few hours when doctors worked on a delicate body, guided by both skill and intuition. Outside the sterile curtains, the father waited, unable to see what was happening but imagining every possibility. He thought of his daughter's first teeth, her laughter, her favorite games. Each memory was a plea to the universe, to let her live and thrive. YouTube. When at last the head doctor emerged, the relief was palpable. The girl was stable, and the critical phase had passed. There were still days of recovery ahead, but the danger had been averted. Tears streamed down the officer's face, tears that released weeks of anxiety, fear, and pent-up emotion. Other parents in waiting rooms watched this release with empathy, understanding what it meant to fear losing someone you love. YouTube. This story is more than just a dramatic event caught on video. It is a reminder of how quickly life can change. One moment, everything seems normal, the next, everything is uncertain. Stories like this show the unpredictable nature of life, and how crucial it is to trust our instincts, especially when it comes to the health and safety of those we love. YouTube. In the weeks that followed, the little girl's recovery became steady. Her father took time off work, staying by her side during every checkup and therapy session. Every smile she gave, every step she took without pain, became a celebration. Friends, family, and even strangers who watched the video sent messages of support and prayers. Many viewers were inspired by the father's quick actions, saying the video reminded them to pay close attention to their own children's health. YouTube. Beyond the emotional impact, the video also teaches an important lesson. When something doesn't feel right, don't ignore it. In medicine, early detection can be life-saving. Many serious conditions begin with subtle signs that are easy to overlook. But when parents listen to their intuition, combined with professional medical care, they drive their life on as the best chance of recovery. YouTube. This video, with its dramatic title and emotional journey, resonates because it captures something universal and human. It is not about fear alone. It is about courage, instinct, love, and hope. It is about the bond between a parent and a child. And it is about the incredible dedication of medical professionals who stay when life hangs in the balance. YouTube. Viewers from all around the world have watched this story and felt its power. Comments reflect a shared understanding. No matter where we come from, the love for our children is universal. Some say it reminded them of their own terrifying health scars. Others thanked the officer for acting courageously. Many thanked the medical staff for their dedication and care. YouTube. In a world often dominated by negativity and conflict, this video stands out as a testament to compassion and humanity. It reminds us that heroes aren't just those who perform extraordinary feats in media headlines, they are also the fathers and mothers who listen to their hearts and act in the face of fear. YouTube. And so, this video is more than just a story. It is a lesson, a memory, a message, a reminder that every moment, every heartbeat, counts. May it inspire every viewer to value their loved ones, act with courage when needed, and never underestimate the strength that a parent's love can bring. YouTube. If you want SEO keywords or tags for this article, or a short form script for TikTok, reels based on this story, just let them know.